It starts with a pinprick of light in the center of your field of vision, something that could easily go unnoticed if it wasn't blocking a few letters from a sentence you were trying to read. But it is. And now you know that you're locked in for a ride that you never wanted to be on. That small point of light gradually turns into multiple points, clustered together as they slowly begin radiating outwards towards your peripheral vision. You try to relax, but you're dizzy, and more than likely experiencing a bit of motion sickness as those clusters begin to look more like a glowing static, almost like a kaleidoscope you can't escape from. No matter where you look, the things you're seeing never change, and closing your eyes brings only the most mild form of relief as you've now lost a good portion of your eyesight. And even if you don't have a splitting headache already, it's just around the corner. This is what an ocular migraine is like for me. Loosely defined as a headache which causes changes in your vision, and it's something which I started dealing with only a couple of years ago. Today I'm going to be giving a little general info on the condition, but mostly I'll be talking about what my personal experience with them has been like. Like a lot of conditions, despite wide-ranging theories, no one is really sure what causes ocular migraines, even if the symptoms are occasionally lacking in a solid foundation that would make people like me feel frontline medical professionals at least have some kind of handle on what's actually going on. Going over the broad strokes. A migraine is a headache that can cause severe throbbing pain or pulsing sensations, usually on one side of the head. It's often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. These headaches can last anywhere from a couple of hours to a few days. Seeing auras isn't all that uncommon during a standard migraine. Where the difference here lies, though, is generally with that all-important vision loss, which doesn't occur in a more standard migraine. So that's as much information as I'm going to be giving you here today, and that's partly because the information you find on the internet is a bit different than what you find when going to the actual doctor. And on that note, if you're experiencing vision loss of any kind for any length of time, you should be making an appointment with a qualified medical professional right now, not listening to a guy on YouTube. So my experience starts roughly 2 years ago when I started having bouts of intense vertigo. I didn't really connect the dots at first, that every time I had one of those bouts, I would have a migraine the next day. Staring migraines and I have been friendly for a long time now, and I'm used to getting dizzy when I experience one. I wasn't processing that disconnect there though. As a general rule, a migraine is thought of as a package deal. You get the nausea, the dizziness, the auras, and the headache all at once. That was no longer my reality though. As the months went by, I started having bouts where I would lose my vision, sometimes getting dizzy, sometimes not, but almost always accompanied by a splitting headache the next day. Naturally, the vision issues worried me to the point that I scheduled an eye exam. But before that came around, a bad enough bout hit that I went to the ER, in that pre-COVID world where going wouldn't put your life at risk. They performed an MRI to rule out tumors, did the usual battery of tests that one would expect, and came back with a diagnosis of ocular migraines. It's nice to have a name to put to any given ailment. Having issues with no straightforward diagnosis has a tendency to leave one in a bit of an anxiety-addled limbo, constantly worrying if death or further disability is just around the next corner. But after the diagnosis comes the journey of finding a solution. I'd worn glasses dry for years at that point, but as is common, I noticed that my vision was getting the worse the older I got. Eye strain can cause migraines, so I figured I'd start wearing my glasses more consistently. An idea my eye doc co-signed when I went the following week, and also got a diagnosis of ocular migraines independent from what the ER had told me. I did my follow-up appointment at the internal med doc, who also confirmed the diagnosis and gave me a script for beta blockers, as they've been known to help prevent migraines through some combination of dark side powers and advanced Harry Potter-esque potions class. And that, as they say, is that. 2 years later, and not much has changed really. At any given moment, I know that I can go partially blind for anywhere ranging from 5 to 60 minutes. It can happen when I'm typing a script, reading, driving, watching a movie, or any other activity you can imagine. There's no warning or set time limit that the blindness will last. As you can probably figure out, I don't drive long distances without backup anymore. So like I said before, this is my personal story. Other people's mileage may vary. Some view this as a profound disability, while others may see it as a mild inconvenience. I don't control the perception of others. I can only tell you how I perceive the realities of my life, and hope that I've done a decent enough job at that today. So thanks for watching. If you like this video, please consider subscribing to my channel, as I'm covering a wide range of physical and mental conditions, as well as covering more cultural and social issues.